Hello, my name is Cassidy Carrico Ellis, and I chose to do my health communication project on the impact of delayed CalFresh disbursements. The research question is, what are the direct impacts on people who rely on their CalFresh benefits when they receive a delayed disbursement like they did during the most recent 43-day government shutdown? I chose to do an in-depth interview, and I chose 3 different people. The first one was Annie. She's a registered dietitian and diabetes education specialist at a hospital outpatient clinic. I recruited her because she's my sister, so she's easily accessible to me, and she's really passionate about food equity. I also chose Vanessa, who's a senior health educator for SNAP Ed at Santa Cruz County. I recruited her because she has a different perspective on the program from a higher up point of view, and she has been working at Santa Cruz County in this position for some time. And I also chose Taylor, who has lived experience of relying on CalFresh benefits. I recruited her because she has an autoimmune disorder and she's on disability, so she's heavily impacted by the inability to get the food that she needs. The interview time was aimed to be 60 minutes. With Annie, we went a little bit over, just because we have a closer relationship. We can talk about more things. We went 68 minutes. With Taylor, we had agreed upon a certain time frame for the phone call, so we stuck to the exact 60 minutes. And with Vanessa, we had scheduled a meeting time, and she had other meetings to attend, so we also stuck to the 60 minutes. To prepare for the interview, I came up with a list of questions to help to lead the conversation, though I did want it to be mostly interviewee-led, and I wanted it to flow naturally like a conversation, not so much like a strict interview. I also had a list of some follow-up questions to help to stimulate the conversation in case we kind of came to a dead end. And I also worked to settle on dates with the people who I interviewed to make sure it worked for them, and I made sure to confirm ahead of time to make sure that we were positive we were able to meet at that time. I found that we all agreed that cutting or delaying benefits is really detrimental to communities. Talking to somebody with lived experience was something that I found was really interesting. It provided a good perspective beyond just the large numbers and political rhetoric, news headlines and such, where people can have all these big opinions, but they don't really understand what it's like to experience that, or even have somebody who has that firsthand experience express to them how important it was. Future research could include other resources that people can rely on if they can't receive benefits, so maybe compiling a list of resources that people can go to if this were to happen again. And I also found that different perspectives on benefits provide a good insight into specific effects on the communities. I also have a couple quotes here. So Annie says, CalFresh lets people have consistent access to a variety of foods. Consistency is a huge part of managing chronic conditions like diabetes. She really emphasized consistency because having a condition like diabetes, which is lifelong, really relies on consistent management of that condition. Vanessa said, helping people to understand their benefits and how to navigate the system is a main part of success in the program. So if the system keeps changing, it can be really difficult to help people to understand the system. So it's basically like the goalpost keeps moving. So somebody like Vanessa really helps to help people understand. Taylor says, since I can't work, I need my benefits to make sure I can easily get groceries and not stress about the price of food. Taylor really talked a lot about stress and financial stress. So in conclusion, delayed disbursement of CalFresh benefits really harms those who rely on consistent access to food. Food can be a major source of financial stress for people, and CalFresh benefits really help to ease that stress. Being able to have conversations with people of different backgrounds can provide good insight into how communities are impacted by these changes being enacted by the government. And finally, advocating for those who need additional support can show up in a lot of different ways, through direct impact, policy, or even community coming together to provide when things like delayed benefits occur.